we're going to talk about something that is, let's be honest, absolutely terrifying: chest pain. But we're going to dive into one of its most common causes, one that, thankfully, is a whole lot less serious than what our minds immediately jump to. You know that moment, that sudden, sharp pain that hits you right in the chest. Your heart starts racing, your mind just goes into overdrive. Is this the big one? It's a question that sends a jolt of pure anxiety through anyone who's ever felt it. And really, that's the conflict right there, isn't it? On one side, you've got this deep-seated fear of a major life-threatening emergency, but on the other, there's the very real possibility that it's just a common, treatable inflammation. Today, we're going to spend some time on that second possibility. So let's really dig in and get to the bottom of the scary symptom by looking at a super common cause of chest pain that has absolutely nothing to do with your heart.
Okay, but before we go any further, and I cannot stress this enough, this is the most important thing you'll hear today. Do not try to diagnose severe chest pain yourself. If you're feeling persistent, intense pain, maybe you're having trouble breathing, you need to seek emergency medical care immediately. The number one priority is always to rule out the most serious stuff first. All right, with that really critical safety message out of the way, let's take a closer look at this condition itself. What exactly is it, and what does it actually feel like?
So costochondritis, in simple terms, is an inflammation of your cartilage. You can see right here, it happens in a very specific spot, right where your upper ribs connect to your breastbone, or your sternum. That little connection point is called the costosternal joint, and that's where the trouble starts. So how would you know if this is what you're feeling? Well, the symptoms are pretty distinct. The pain is usually in that upper and middle rib area. But what really makes it stand out is how certain things make it worse. Taking a deep breath, or coughing, or even just the pressure from a seatbelt can make that pain flare up. Moving around, doing some physical activity, or even just lying down can make it feel more intense too.
So you go to the doctor with these symptoms. How do they actually figure out what's going on? What's the process?
Now, this is a really key thing to understand. There is no single costochondritis test. It's not like they can take a blood sample and say, yep, that's what you've got. Instead, getting to a diagnosis is all about a careful process of elimination. This whole diagnostic journey follows a pretty logical path. First, your doctor's going to talk to you about your symptoms and your medical history. Next, they'll almost certainly want to rule out any heart problems, usually with an ECG. Then maybe an X-ray to make sure your lungs look okay. And it's only after those big, serious issues are off the table and your symptoms line up that a doctor can confidently say, okay, this is costochondritis.
And this is a great way to see the key differences a doctor is looking for. With costochondritis, the pain is often really specific. It's localized. It's tender to the touch. You can literally press on the spot and make the pain worse. Heart attack warning signs, they're usually different. We're talking about a persistent, intense pain that might radiate out to your arm or jaw, and it's often paired with shortness of breath.
Okay, so let's say the diagnosis is in. What's next? Well, the good news is there's a pretty clear roadmap for getting better. A lot of the time, finding relief starts right at home. The main idea is just to give that inflammation a chance to calm down. That means rest. It means avoiding stuff that makes it worse, like heavy-duty exercise. Something as simple as a heating pad or an ice pack can feel amazing. And for some people, physical therapy can really help manage it for the long term. Now, if the at-home stuff just isn't cutting it, doctors have more tools in their toolbox. The first step is often over-the-counter anti-inflammatories, like ibuprofen. If that doesn't work, there are prescription-strength versions, steroids, or even something called a TENS unit, which uses a tiny, mild electric current to kind of scramble the pain signals. So what's the long-term prognosis here? Let's talk about what you can expect, and, most importantly, what you should remember from all of this. And here it is. The big takeaway, the most reassuring part of all this. For most people, this condition is not a life sentence. It's usually a temporary problem that, with a little bit of time and care, just goes away on its own. So how long does it stick around? Well, it varies. If it's a really mild case, you might feel better in just a couple of days. More often, it takes a few weeks for it to fully resolve. And while some cases can be stubborn, the vast majority of them are gone within a year. Now, it is important to know that for a small number of people, this pain can become chronic, and sometimes it can actually be a sign of a broader condition, like fibromyalgia. So if the pain just isn't going away, it's really important to keep that conversation going with your doctor to figure out what's happening.
At the end of the day, any pain you feel is your body sending you a signal. It's trying to tell you something. And while costochondritis is often a harmless explanation for chest pain, it's a really powerful reminder to listen to what your body is saying. And the first, most crucial step in that process is always to get a professional to help you translate the message correctly.